Developing this evening ahead of a 3-day nurses strike at 6 Providence hospitals next week. It appears that tensions could not be higher. Alma McCarty's in the newsroom. So Alma, what is going on here?
Well, David, Providence has accused the union, the Oregon Nurses Association, of interfering with patient care by calling on other nurses not to accept contracts at the 6 hospitals, while the union is accusing Providence of violating Oregon's nurse safe staffing law. Lots to unpack here before the strike even starts.
Last week, the Oregon Nurses Association delivered its 10-day notice, alerting Providence that 3,000 members working at 6 hospitals would strike for 3 days, starting this Tuesday at 6 a.m.
A strike is a very, very, very serious action.
This comes after 6 months of bargaining. Nurses asking for better pay, a better nurse-to-patient ratio, and better health benefits. The locations impacted: Providence, St. Vincent, Newburgh, Willamette Falls, Medford, Hood River, and Milwaukee.
Be respecting their right to do that as we continue to provide care for our patients.
But now, just days out, Providence claims union tactics could be hindering their ability to continue providing patient care during the strike. Here's Jennifer Gentry, the Central Division Chief Nursing Officer with Providence.
This isn't a shop floor. This is a hospital. And we have patient lives in our hands. And so our words really matter, and we're asking for respect for that.
Providence is addressing an ONA letter which calls on all nurses to stand in solidarity and to not accept travel nurse contracts scheduled to start in June or July. Providence announced last week that their facilities would remain open during the strike and that they'd fill those gaps with replacement workers.
The world of replacement nurses, if they feel intimidated or if they're feeling like this isn't a place that they're welcome to come or they are safe to come, then it's possible they wouldn't choose to accept those contracts, and that could negatively impact patient care.
The union pushing back in a statement, writing that if Providence were truly concerned about recklessness and patient safety, they would not have cut off negotiations early and would be at the bargaining table right now. And ONA says a call to not cross the picket line is standard practice for all unions engaged in strike action. Providence doesn't have final numbers on replacement nurses, but says come Tuesday, patients should still expect the same level of care.
We want our patients to know that they shouldn't hesitate to come to us if they have a need. We'll be here for them, and our doors will be open.
The union today also sent a cease and desist letter to Providence saying it was violating the safe staffing law. That mandates staff-to-patient ratios and directs hospitals to use committees to come up with how best to staff each department. ONA says Providence is adopting staffing plans without consulting other nurses. We'll be sure to follow these developments throughout the next week.